Hello friends, myself Dr. Pratibha Palai, a first year surgery PG resident. In my videos, I will be explaining regarding the details of surgeries, regarding the anatomy, and in this video I have made a complete details regarding a thyroid gland. In my last video I had explained you my friends regarding the anatomy, regarding the structure of thyroid gland, regarding the relations of thyroid gland, and in this video I will be explaining the blood supply, the nerve supply of thyroid gland, a complete details, and at the end I will explain regarding the examination of thyroid gland, how to examine the thyroid gland in a patient. And in my next videos I will be explaining the surgeries of thyroid gland and regarding the hypothyroidism, regarding the hypothyroidism, so we can get a complete details of a thyroid gland. So these will help the MBBS students, and also this will help the first year PG residents of surgery. Hope I provide some information through these videos. Hope you like my video. Starting with the arterial supply of the thyroid gland is supplied by three arteries, that is the superior thyroid artery, inferior thyroid artery, and the thyroid ema artery. So here I have done a diagram. Here you can see this red line, this is the superior thyroid artery, okay, and here you can see I have made this green color, this is the external laryngeal nerve, and below you can see this is the inferior thyroid artery. So below it's supplied by the inferior thyroid artery, and from superiorly above it comes through the superior thyroid artery. Here you can see this is the parathyroid gland. A branch of the inferior thyroid artery supplies the parathyroid gland. Here I have made a diagram. Here you can see this is the thyroid ema artery. It supplies basically this area of thyroid gland. So starting with the superior thyroid artery. Superior thyroid artery is a branch of the external carotid artery, and this artery runs downward and forward in close relation to the external laryngeal nerve. Here you can see this diagram, and you can understand clearly this superior thyroid artery and the external laryngeal nerve, how it supplies the above part of the thyroid gland. Next, coming to at the upper pole, artery divides into the anterior and the posterior branches. So the superior thyroid artery anterior border descends on anterior border and continues along the upper border of isthmus and anastomose with its fellow opposite side. And the posterior border, it descends on posterior border and anastomoses with the ascending border of the inferior thyroid artery. Here you can see friends, in my last video I made a diagram explaining regarding this. You can see this is the thyroid gland, this is the isthmus region. This is the superior thyroid artery, which is way back dividing. This is the anterior branch and this is the posterior branch. And this one is continuing with, this is the ascending branch of the thyroid artery, which comes from the inferior thyroid artery. Here we can see the external carotid artery. It gives branch in the neck. But the internal carotid artery, there is no branch in the neck. So next, with the inferior thyroid arteries details. Inferior thyroid artery is a branch of the thyrocervical trunk. Thyrocervical trunk is a branch of the subclavian artery. Inferior thyroid artery runs upward, then medially and finally downward to reach the base of the gland. Its terminal part is related intimately to recurrent laryngeal nerve. I have shown you in the diagram like how the inferior thyroid artery runs artery divides into 4 to 5 glandular branches which pierces the fascia separately to reach the lower part of the gland. So friends, here you can see, I have made this diagram. Clearly you can see this is the inferior thyroid artery. Okay, this one is the subclavian artery, this is the inferior thyroid artery. You can see this one is giving small branches. This is supplying this part of the thyroid gland, that is the lower part of this thyroid gland is supplied by the small branches of the inferior thyroid artery. There is one ascending branch of this inferior thyroid artery. It anastomoses with the posterior branch of the superior thyroid artery and it supplies the parathyroid glands. There is another artery, this is the thyroid ema artery, which is also known as the lowest thyroid artery. It is seen in 3% individuals. It arises from the brachiocephalic trunk directly from the arch of aorta. It enters the lower part of the isthmus. There is another artery which supplies the thyroid artery. This is the accessory thyroid artery, which arises from tracheal and esophageal arteries. Here we will discuss regarding the venous drainage of the thyroid artery. The thyroid artery has 3 veins. Basically there is another vein, that is the fourth also. So starting with the superior thyroid vein, middle thyroid vein, inferior thyroid vein, and there is a fourth thyroid vein, that is the coccyx. Superior thyroid vein, it emerges at the upper pole, accompanies the superior thyroid artery, and it ends in the internal jugular vein. The middle thyroid vein, it emerges at the middle of the lobe and it ends in the internal jugular vein. And the inferior thyroid vein, it emerges at the lower border of the isthmus and it ends in left brachiocephalic vein. The fourth thyroid vein, which is also known as the coccyx, it may emerge between the middle and the inferior thyroid vein and it drains into the internal jugular vein. Next, coming to the lymphatic drainage. From upper part of the gland, it drains into the upper deep cervical lymph node. So friends, you can know that the thyroid gland is present in the cervical region. So it will drain ultimately to the cervical lymph node only. So either directly or through the prelaryngeal node, it drains into the cervical lymph node. And from the lower part of the thyroid gland, it drains into the lower deep cervical lymph node. Next, coming to the nerve supply of the thyroid gland. The nerves are derived from the middle cervical ganglion and partly from the superior and inferior cervical ganglia. In this video friends, I will be explaining regarding the examination of the thyroid gland. Till now I have discussed regarding the anatomy of the thyroid gland, that is the structure of the thyroid gland, the relations of the thyroid gland, the artery supply, nerve supply, and the venous drainage of the thyroid gland. So now I will be discussing regarding the thyroid examination. Thyroid examination, we will be dividing the examination into 4, that is the inspection, palpation, percussion and auscultation. In thyroid examination, starting with the inspection, first we will be inspecting the face of the patient, that is either he is anxious, either he is agitated, either he is fidgety. So this will be seen in hypothyroidism. Looking at the hands, that is thyroid acropathy. If it's present, then it is the Graves' disease. And next we will see the peripheral tremor. It is seen in hypothyroidism. If the skin is dry, it is hypothyroidism. If palmar erythema is present, it is hypothyroidism. And if sweating is present in palm or in the skin, it is the hypothyroidism. In inspection, we will see the pulse rate of the patient. If the pulse rate is more, that is tachycardia, it will be seen in hypothyroidism. And if the pulse rhythm is low, then it will be hypothyroidism. If it is irregular pulse, then it is atrial fibrillation and it will be seen in hyperthyroidism. Looking at the face of the patient, if there is sweating is present, it will be hyperthyroidism. Dry skin, loss of outer third of the eyebrow, it is seen in hypothyroidism. Next, we will be looking at the eyes of the patient. If exophthalmos is present, it is Graves' disease. If lid retraction is present, it is sclera visible above the iris. Then inspect for anterior displacement of eye out of the orbit, that is the exophthalmos. Eye movement, that is the H test, and observe for restriction of eye movement. Assess if there is any lead lag in the patient. Then coming to the next, that is the neck, inspect the neck. If there is any skin changes like erythema, if there is any scars, that like if there is any previous history of thyroidectomy, if there is any mass like goiter or a lymph node. Ask the patient to drink water and observe the movement of any masses while swallowing. And ask the patient to protrude the tongue. Movement of any masses will be seen. If there is no movement, then it is the thyroid gland mass or the lymph node. If there is upward movement, then it is the thyroglossal cyst. Now I will discuss regarding the palpation of the thyroid gland in examination. So ask the patient to flex the neck slightly forward and relax. Begin palpation at the thyroid cartilage, which is known as the Adam's apple. As you move downward, you will reach superior edge of the cricoid cartilage. Below cricoid cartilage, it is the isthmus of the thyroid gland. Palpate the isthmus and assess each thyroid lobe and ask the patient to protrude the tongue, that is the thyroglossal cyst will rise. Ask the patient to swallow and assess the symmetry of the thyroid lobe elevation. Asymmetry may suggest unilateral thyroid mass. Palpate the local lymph node for any lymphadenopathy and assess for tracheal deviation, that is a large goiter. Next, coming to percussion. Percuss to detect any retrosternal dullness or large goiter extending inferiorly. In auscultation, auscultate each lobe of thyroid, that is the right lobe and the left lobe for any thyroid bruit. Its increased vascularity is secondary to Graves' disease. We can see some special reflexes in this examination like hyperreflexia associated with hypothyroidism, and inspect for pretibial myxedema, that is Graves' disease. Assess for proximal myopathy, that is the hyperthyroidism.
Hope you like my video, friends, and meet you in my next video with the complete details of the surgeries of thyroid gland. Till then, please do subscribe my channel, like, share, and do comment in my video Pratibha's Nature Delight. Thank you, friends.